Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute immune hemolytic anemias, and we are focusing on the classification. So under this, let's look at it's divided into two, that is the warm autoimmune hemolysis and the cold. So let's look at warm autoimmune hemolysis. So under the warm autoimmune hemolysis, there is an antibody. So when you look at the antibody, it is about its IgG, that is about 37 degrees Celsius. Next is secondary to the viral infection. So secondary to the viral infection, it is the HIV as well as the viral vaccine. So HIV as well as the viral vaccines. Next is secondary to the other infections. And what is it associated with? So it is associated with the SLE. Next is the chronic lymphocytic leukemia, CLL. Then the inflammatory bowel disease, we are writing it as IBD, as well as the post-allogenic HSCT. So this was all about the warm AI autohemolysis. So then we look at the cold. So we look at the cold autoimmune hemolysis. So cold is associated with the IgM. So cold is associated with the IgM, whereas warm was with the IgG. So cold is the IgM, and the degree, if you see, it is a 4 to 30 degrees Celsius. So what are the secondary infections? So it's secondary to which viral infections? When you look at the secondary to which viral infections, it includes the EBV. So it includes the EBV, it includes the CMV, as well as the other viral infections. Now let's look at secondary to other infections. So it's secondary to what other infections, such as the mycoplasma. So it's secondary to the infection of mycoplasma. Then what are the other things it is associated with? So it may be associated with that of the Waldenstrom's disease. So it can be associated with the Waldenstrom's disease, and then also the lymphoma. To learn and grow daily like this, please do subscribe.